told you you're ill, so we have to run multiple tests on you, you'd believe them. Because doctors are qualified individuals who know best about what needs to be done to treat our illnesses or enhance our health. Not only do they play a huge role in our lives, but in fact, they save them. So who is there for patients to trust more than the people who do just that? If anything, trust is seen as an element that is key in the relationship between a patient and a doctor, and is almost always accustomed. So much so that, according to the Telegraph News, 92% of patients trust their doctors to tell them the truth. The secret is that patients see doctors as people who are trying their best to help them, not like businessmen or insurers that are just trying to take their money. But what would happen if that changes? If doctors become the people that are trying to take their patients' money? What would happen to the trust we have towards the doctors that treat us? That is something that I questioned earlier this year when I visited a doctor in a private clinic due to consecutive headaches I was having. After one single consultation, my doctor prescribed me blood tests, 13 of them, and an ultrasound in my lower abdomen. Now, to remind you again, this was for a headache, but I never second-guessed my doctor's decision. I was assured that, as a qualified individual, he knew best. So 2 weeks later, my results had finally come in, and I had a follow-up appointment with that same doctor. To summarize how that appointment went, well, let's just say that it did not last longer than 5 minutes, and it just consisted of the doctor telling me that nothing was wrong right before I was dismissed without any solution. While I was anticipating to finally get help for all my headaches, especially after all those tests, I rather ended up with no results, just wasted time and money. Now, that instance is all it took for me to realize that something was off. So naturally, as an individual who is interested in and hopes to one day be part of the medical industry, I decided to explore this prescription situation a little further. So here's another case I stumbled on, for which confidentiality reasons we will be calling the patient, in this case, Tom. Around 20 years ago, Tom had been feeling irritation in his eyes and so decided to visit one of the best ophthalmologists in their private practice in New York. In that same appointment, Tom was diagnosed with glaucoma, a progressive disease that can lead to blindness. So the doctor instructed Tom to make appointments every 4 months to check up on the progress of the disease and prescribed eye drops and a field vision test every year. While that seemed to work out for a little bit, Tom began to feel a little unsatisfied with all these appointments and tests, and so decided to get a second opinion from another doctor in a public hospital. So this doctor took down Tom's medical history, but noticed that his apparent glaucoma, a progressive disease, had not progressed in those past 20 years, which led them to the possibility that maybe Tom never had glaucoma. After a few tests, it was confirmed that Tom never had the progressive disease, and although the eye drops prescribed by the private practitioner were fortunately not harming Tom's vision, they were completely unnecessary, and turns out, so were all those appointments every 4 months. Just like I had, Tom ended up with wasted time and money. When comparing these cases side by side, it becomes evident that mine and Tom's stories overlap in some areas. We see similarities in our doctors who had, 1, been working in private for-profit clinics or hospitals, 2, had been over-prescribing unnecessary treatments or medications to us for whatever reason, and 3, had left us both with wasted time and money. What happened to Tom and I may appear as a simple coincidence. However, this is something that is becoming so common that a majority of you might even be able to recall a personal experience similar to this. You see, doctors working in private for-profit clinics or hospitals over-prescribing unnecessary treatments or medications. The dots connect pretty easily to reveal that doctors working in private clinics or hospitals are over-prescribing unnecessary treatments or medications with the incentive of financial gain. In fact, according to the National Center of Biotechnology Information, 92.4% of false medical prescriptions comes from the motive of financial gain. More than just that, the Omani Center of Biotechnology Information claims that doctors who are overprescribing unnecessary treatments or medications are more often than not being pressured to do so by insurance companies or hospital corporates. And so this is what has become the root of the predicament at hand. What insurance companies are supposed to be doing is help patients when they're in need of money, yet in recent years, they have instead started using health services not as per needed by the patients, but as per the requirement of the insurance company. To put it in perspective, it only takes a couple of patients paying for expensive treatments, whether necessary or not, to pay off, let's say, a part of a debt for a clinic. And it is through these means that many private clinics or hospitals are able to function while simultaneously making profit. And therefore, to cater to such needs, doctors are constantly being pressured to reach certain financial targets. To the extent of which, in some countries, physicians who achieve these financial targets are rewarded with bonuses or high ratings on insurer websites, while physicians who deviate from such metrics are given poor ratings on these same insurer websites. And it is because of these pressures that many doctors today are businessmen first and doctors second. The business industry has latched onto healthcare, and there are no signs that it will be letting go anytime soon. The modern medical system is designed to maximize profits by preying on its patients when they are most vulnerable. The business industry latching onto healthcare, one of the most inelastic fields, is quite simply wrong. Because in the most desperate moments, one can't put a price on life, so of course patients who are helpless or unaware would pay whatever cost, and who wouldn't? It is almost scary to see how much the medical industry has changed, because healthcare never used to be like this. 2 decades ago, the medical system valued the health of its patients above anything else and made healthcare accessible to all. Yet today, money and profit is all that it has to offer. For the corporates, that is. Whereas for the patients, or at this point, shall I say, consumers, we are rather left with drained pockets and our health sometimes even more harmed than it was initially. And now it seems almost impossible to go back to the way things used to be, doesn't it? Well, the UK doesn't think so. Neither does France, Germany, Singapore, Denmark, or any other country with a national healthcare system. In fact, none of these countries face hardly any issues with overpriced medical attention, and the reason? Because public healthcare does not ask for more money than is necessary to run the clinic or hospital and pay the doctors their salary, no profit included. To help you understand the difference, in the United States, for example, Dr. Patricia Salber compared the salaries of doctors working in the public and private sector and found that a consultant doctor working in public healthcare made on average $274,000 a year, while a doctor with the same specialty who worked in the private healthcare made on average $348,000 a year. That's a difference of $74,000. So what does this tell us? That healthcare can become dangerous when it is in the hands of private, for-profit clinics or corporations, and that corporate greed is degrading the entire system. But what I don't want you thinking is that the provision of all healthcare is like this. However, the reality is that this is an issue, and one that is becoming more common than we might think. This part of the medical industry is becoming, let's say, twisted in a sense, but that doesn't mean that it has to continue affecting us that way as patients. And so what the situation calls for is awareness and action upon the awareness. As patients, we may feel completely insignificant to this all. However, we are actually the most powerful group of people that can unanimously initiate this change. Just because the medical industry is becoming more profit-driven doesn't mean that we should agree to compromise to such standards. The way we as patients worship doctors as authority figures, leading us to blindly believe everything we are told, is not benefiting us in any way, especially since in recent years, doctors have been finding it easier to take advantage of their patients' trust by overprescribing unnecessary treatments or medications. To prevent this, it is our right as patients to ask questions about the treatments or medications we are prescribed, to demand transparency. we're not understanding the purpose behind a prescription your doctor gave you, there is nothing wrong with confirming the reason. After all, these treatments or medications are for you, so asking about further details or even the level of necessity is not out of line in any way. Doctors in the private medical industry will have to start taking it into account the demands of its patients. And when these suspicions and awareness begins to arise, the medical system will have to stop taking advantage of their patients' trust. But that is something that only the patients can push for, which is you. So the next time your doctor tells you you're ill, so we have to run multiple tests on you, ask them why. After all, it is your right. Thank you.